Thank you, my Deputy Dean, for this wonderful presentation. Well, I have no conflict. I have no conflict of interest in this lecture I'm going to deliver. The 56th University of Calabar Medical Induction Lecture. Well, I've already stated I don't have any conflict of interest. That is the title of my lecture, The Noble Calling of Medicine, Maintaining Excellence, Ethics, and Apathy. The protocol align with the established protocol. I want to specifically recognize the chairman with the vice chancellor, ably represented by the DVC Academic. She's a good sister of mine. The rep of the MDCN, and elders of the medical profession, our CMD, the provost of several of the colleges here present, and the deans. We can go on to talk about the parents, very important to us, as I'm one of them. And my wife is here. Thank you very much. And all the inductees, you are highly welcome to this lecture. And I want to use this opportunity to thank the Almighty God for bringing all of us here, and to say that things are getting better. At least we have just inducted 92 doctors who will take over from us. So I'm also grateful to the provost for approving my being the lecture. Provost of medical colleges, my friend. Also grateful to the deans, most specifically our amiable dean, Professor Ewa, for finding me worthy to present this lecture. I will talk later as we go on. And also the physicians' oath-taking committee, the teachers of these medical doctors, parents that have found time to be here with us. We are grateful. I'm also grateful to colleagues who are here with us. Preamble. On behalf of the provosts, the deans of the faculties, and all the trainers, both clinicians and non-clinicians, I hereby congratulate the inductees on their well-deserved completion of medical training. You all know that it was rigorous. And we thank you for allowing us to teach you and for being receptive to our teaching. So you are welcome to the noble profession of medicine. Induction into the medical profession, the physician's oath taking, is significant because it formally introduces inductees to ethical responsibilities, values, and duties of medicine. It symbolizes the beginning of your lifelong commitment to the service of humanity, a profession dedicated to serving lives, reducing suffering, and promoting health. It serves as a foundation for professional conduct, compassionate service, and lifelong dedication to healthcare and humanity. What are the other benefits of induction, which we have just conducted? It is also a period to introduce ethics, which The rep of the registrars has already done so. Introduce ethics, values to help you build professional identity. You have to identify yourself that you're a doctor. This induction is all about that. It's also to encourage lifelong learning and also to promote patient-centered care and evidence-based medicine. It also helps to strengthen accountability to society. As doctors, you are supposed to be accountable to the society. It's also to motivate your colleagues, your younger colleagues that may be here with you, and to inspire new students to the profession. The profession is in dire need of people, and so they should do that. Physician oath-taking. What is medical sponsio academica? In medicine, sponsio academica, as it is called, is used as a formal professional pledge taken by medical graduates. Other professions, especially in the College of Medical Sciences here, also take pledges. Sponsio is a Latin term which means solemn promise or pledge, while academica means academics. It started from the 12th century AD, when people were made to swear to uphold their profession and to defend it. The registrar representative had told us that you need to defend this profession, even at the point of death. That is very interesting. The College of Medical Sciences of the University of Calabar has been in the fore in Nigeria in keeping to the spirit and ethos of medical sponsio academica since 1983. So, Prof, I congratulate you for keeping to the spirit. Where we were trained, some of us were sworn in before you finish your final exam. Some were sworn in just immediately after your results are released, the same day. I was sworn in a day after my results were released. So I didn't have this opportunity of gathering so many people here. So congratulations to the college. But when we now came to Calabar, we started hearing sponsors everywhere. And the college has been able to uphold it till now. So congratulations to the college. It represents commitment to professional ethics, using knowledge and skills for the benefit of humanity, respect for the profession, lifelong learning, and integrity. That is the sponsor. It reminds graduates, as you are now, that society trusts you with important responsibilities. One of them is that they tell you all the story about their lives. So it's a great responsibility, and you must be accountable. So you have already made this pledge, and I say congratulations again. The Hippocratic oath of our noble profession, now known as the physician oath, focuses on patients' welfare, confidentiality, ethical conduct, and compassionate care, which you will recite or already recited as a symbolic transition from studentship to professionalism. This is my topic, the noble calling of medicine, maintaining excellence, ethics, and empathy. When the dean phoned me and asked me that he was choosing me, I told her that I'm one of the parents. She said, it doesn't matter. It's okay. Give me the topic. She said, Anna, choose your topic. So this is my topic. And at that point, I was also preparing preparing for a symposium on our 50th anniversary of the West African College, which we are mounting. And so I just flew. So some of the things you are hearing here is part of that program. So thank you very much, Dean, for being that trustworthy to give me this enormous task. The noble calling of medicine. A noble profession is a type of work that is respected not just for the income it brings, but for the positive impact it has on other people and society. And medicine is that profession that has impact on other people and society. Your action and inaction will affect people. And so, you know that this calling is very serious. The goal goes beyond personal gain. It aims to help protect, educate, and improve the lives of others. When you help someone that is almost dying, then you have done something for that person. The key characteristics of a noble profession are service to others. Of course, integrity, ethics, responsibility, and positive social impact. This calling is devoted to the preservation of life, which we keep repeating it, the relief of suffering, the promotion of human well-being. It is focused on service to humanity, and most often and permanently non-profit. We'll reach there as time goes on. Medicine is both science and emotion. Medicine is the art of serving and improving lives, and so it's a noble calling. Hold on to it. Hippocrates, a Greek physician, the father of medicine, as so stated that wherever the art of medicine is loved, there is a love of humanity. Wherever you practice medicine, know that there is a love of humanity. You cannot do this without a love of humanity. He went on to state that life is short. He said, you are Methuselah. Art is long, opportunity fleeting, experiment dangerous. You don't use to experiment on any human being. That's why you need to imbibe excellence in your practice. Judgment is difficult, therefore act nobly. Medicine was handed over to us by noble men, and today we do so to you, the inductees. So congratulations. Prepare to hand over to those coming after you. That is the whole essence of medicine. You have to prepare to hand over to those that are coming after you. Maintaining excellence in practice, the second part of this lecture. To maintain excellence in medical practice, remember that it is a commitment to lifelong learning. Medicine needs continuous learning. And so many of our children don't want to follow us because they don't like continuous learning. And it's also you need continuous professional development. It involves learning the importance of competence, diligence, and evidence-based practice. In addition, you must adapt to technological advancement and health challenges to maintain professionalism. We are talking about AI, and the symposium we are mounting is on AI. So you need to move from where we were when we were initially inducted to now. A long time. Medicine represents the heartbeat of healthcare. And as a pediatric cardiologist, we'll take you a little away from to know the heart. The heart does not work alone, nor should your clinical approach. You cannot work alone. Medicine is a collaboration. As a physician, just like the sinoatrial node, forgive me if is that portion of the heart that God designed for each and every one of us. And when I teach students, I say the way our hearts were designed by God, we're supposed to be immortal. No one is supposed to die. And so that sinoatrial node keeps moving. The most important thing with this sinoatrial node is that whenever it stops functioning or there's a disease, any other part of the heart can take over. And so it is in medicine. When you are not applying yourself, when you are not well learned in the acts of practice, you can easily be overthrown. The heart doesn't stop. Other part of the heart will keep kicking to make that. So it is the heart. So it is in the health sector. Without collaboration and showing leadership, others will strive to take over. Thus, as a newly inducted medical practitioner that will be catapulted or already been catapulted to the leadership in the health sector, with no experience, you don't have any experience, learn the ropes by adopting interdisciplinary and even cross-disciplinary collaborations. Excellent through collaboration. I want to tell a life story of one of my senior colleagues, of blessed memory. In his autobiography, he stated his experience in a London hospital. He was asked by the consultant to prepare a patient for surgery of the colon in a supposed patient with malignancy. That is in the late 50s, 1959, sorry, where you didn't have a lot of gadgets to assist. And so this consultant had already planned, just go and clap after a full examination. On completion of the history taking, which is the art we develop, an examination, he talks otherwise. He pondered over the diagnosis and had to discuss with the ward nurse and told the ward nurse, I don't think what my senior colleague is saying is completely true. Because at that time, the patient has developed fever. And at that time, he has sent for a result. And he has started seeing what we call acute phase reactants. And say, wow. So he was now finding it difficult. Should I continue with this? And now approach a nurse. The ward nurse said, doctor, you are a doctor. Do your own diagnosis. Of course, he made his own diagnosis. And it turned out that his diagnosis was the correct. So, learn to make your diagnosis. So this is collaboration. You need others to effectively practice medicine. Everywhere in the health sector, everyone in the health sector is important. So take everyone important in the health sector. Ethics. That's the third thing we are going to discuss. Ethics, we have all been told by a representative, the representative of the registrar. Ethics is the bottom line. It is the foundation of medical practice. is the foundation. Everything about medicine is ethics. You have all been taught what we call beneficent, non-maleficent, autonomy, justice, confidentiality, and patient privacy, honesty and accountability in practice. This is what you need. Beneficent, we all know, is this my treatment, will it benefit this patient? This my treatment, will it harm the patient? I do no harm, no maleficence. The patient, we all know, is the driver. I used to tell patients that the word was not coined mistake. Patient means patient. They should learn to have patience. Because you can make mistake and give things that do not. This our treatment. Is it fair to all? Is there justice in it? The last is paternalism. Paternalism is where a healthcare professional takes decision to a patient, for a patient. So you become an advocate. This is very common with us in pediatrics, where you are fighting within the autonomy of the parents, the caregiver, autonomy of the child who is a minor. So you need to use these to help. Sorry. The next thing we are going to discuss is empathy and compassion in patient. Empathy in patient care. Empathy is the ability of a health professional to understand a patient's feelings, experiences, concerns, and perspective while communicating that understanding with compassion and care. Compassion, for us, is the humane response to another's pain. You are feeling the patient's pain, expressed through kindness, empathy, and a sincere desire to help. Empathy encompasses listening. You listen attentively, develop that act. Explaining calmly and respectfully. Shows patience and understanding to promote comfort alongside with medical care. You also need to respect to patients regardless of status, religion, which we have all been told, ethnicity or background. And the registrar has added sexual orientation. In those days, sexual orientation used to be a psychiatric problem. These days, they have been incorporated to the ethics. I was telling the provost, this has now been incorporated. So that is the system we are now. Understanding how someone feels when doctors fall ill, they often say that they understand how patients feel. Don't wait to fall ill for you to say, oh, I didn't understand this patient better. What are the advantages of showing compassion? The advantages of showing compassion. We are told that the healing power of kindness and reassurance cannot be quantified. It brings hope to a hopeless situation. We are always told in medicine that you can starve for a long time. In those days, we used to listen to Irish Republican Army resistance movement. Some of them starved 70 days before they die. You can also live long without water. But it's always said that your patient would die within 24 hours if there is no hope. So you must try to bring hope to a hopeless situation. Compassion improves doctor-patient relationship. It enhances communication, improves patient satisfaction, better treatment, compassion. In those days when we used to follow buses, you see some itinerant pattern medicine dealers. And the story was once told of a man in a place that was told to take medicine every market day. So he keep moving from one market. When he moved from one market to another market, he would take one because there was no other interpretation. So you need to tell the person to better promote better treatment. It reduces patient anxiety and fear. He encourages holistic care. Medicine is about holistic care. It is often stated that patients may forget treatment details, but they remember how a doctor made them feel. How will you make your patient feel? Examples, we have about 2 examples we need to bring. It can be summarized by the message of Mother Teresa, a passionate and compassionate nun who worked in India at that time, on empathy, communication, and emotional intelligence. She averred that too often we underestimate the power of a touch. A smile, you put a smile in your mouth, your face. A kind word, what do you tell your patient? A listening ear, and an honest compliment. Children love it. As pediatricians, we often do it. If not, the next time you'll be in trouble with the child. Show compassion because it can turn a hopeless situation to hopefulness, which I've stated before. Similarly, William Osler of the Johns Hopkins Medical School stated that the good physician treats the disease. The great physician treats the patient who had the disease. The choice is for you to be a great physician. And for you to be a great physician, therefore, treat the patient that has the disease, not the disease. The disease does not identify a man. The disease does not identify anybody. Disease is not an everlasting thing. Disease. What are the challenges you are going to face as young doctors? Challenges. Number one is burnout and mental health. I've seen consultants, psychiatrists here. They have them in quantum. A lot of burnout in the system. You have been advised to seek to do your house job in other places. Avoid some of those medical places. When I finished my school, I went to a general hospital. I said I wanted to rest. So it was a good advice. Burnout This morning I was reading a story of a young man that died somewhere in London today on burnout. It leads to death. Burnout. Workload and long hours. Try to avoid workload and long hours. Many of us are still practicing it. Workload and long hours. People went on strike for this. They used to work 80 hours a week. And many were dying until young doctors decided to reduce it to 40 hours. Difficult clinical decisions. You are going to face difficult clinical decisions. There's a lot of difference between being a student and being a doctor. You have to get decisions. My personal experience some 40 years ago, as a house officer, the first day I reported to my center, I told you I work in a general hospital. I was the only house officer. I was the registrar, I was the senior registrar. The only next person was the chief consultant. He just handed me a patient. So go and do incision and drainage. I've never done incision and drainage before. It's not an abscess. So I decided to use the knowledge I had in anesthesia. My anesthetic lady is here. So I said, what will I use? I remember we were taught lidocaine. I said, let me infiltrate. The lidocaine itself caused pain. We didn't have this surface lidocaine that time that you can rub. So I did it. And that same hospital, I personally had as a young man, child, I actually had I&D 2 times. So I was going to do better because I knew when I had I&D, as in shown drainage, I well that my mother had to run into the theater and said, that voice is not right. So the young lady cried, and then the consultant was there. He now came and took over. Despite the anesthetics that I used, the cry was still much. I hope now we are using better things. Thank you very much. So these are difficult challenges that you are going to face. There's also the problem of balancing career, family, and personal life. How are you going to balance this? Most specifically for our ladies, balancing career, family, and personal life. You have to wake up at night to call. These days you sleep in the hospital. These are challenges that you must ask your colleague that had done so. Also the challenges of industrial disputes, several industrial disputes. A lot of challenges. I'm sure most of you, this class, since I'm part and parcel of that class, each of them spend at least an extra 2 years to finish this course. So a course that was supposed to last 7 years or 5 years or 6 years, they ended up doing 7, 8, and 9 years. This is as a result of industrial disputes. You are going to be caught up. You have in every sector. In fact, the problem of training, even and working, is that the strike that you are not part and parcel of, that doesn't concern you in the hospital, will affect you and your mental orientation. Know your limits. The elders are there for you. Know your limits in your practice. You're also going to face with low job satisfaction. Somebody did a study on young doctors, on their satisfaction index. It was less than 50%. But strive to work despite this. Practicing defensive medicine. I've heard about litigations. A lot of practices of young doctors now are defensive medicine. Not daring to ask for things or asking for too much. You just write all the gamut of investigations that a patient needs. That should be avoided. Practice medicine the way it should be practiced. Do your part. Show compassion. And at the end, the patient will be appreciated. How to overcome these challenges? My encouragement is to seek mentorship. Seek mentorship. Medicine is all about mentorship. Build resilience. Some of you started building resilience by having study groups. That is resilience. Maintain integrity despite challenges. You are going to face a lot of challenges. But when your integrity is measured, where will it place you? Aim to maintain it. You have also been told to avoid unethical shots. Ethical shortcuts. You don't need to fly alone. I learned it's only eagles. Eagles fly on their own. When eagles are flying, they fly as eagles. In medicine, you don't fly only as doctors. You fly with everyone. The nurses, the lab scientists, the world athletes, everyone, the administration. You fly with everyone. If you learn the rope, then there will be no problem. One of our elders, that was elder surgeon, was telling a story in his 90-something birthday this year. Told a story. He has a young son that is a doctor working in California. And so they were in the theater for 6 hours doing surgery. Each time they tried to arrest the bleeders, there were a lot of problems. They keep bleeding and they transfuse so many blood units. And you know, you need to learn. So in the process, he came out and phoned the father in Nigeria and told the father, this is for 6 hours. We have been trying on this patient. We have done a lot. Life story is a true story. He told us during his birthday. So it's a life story. We are talking about not flying alone. So the father advised him. He said, it was a laparotomy. They opened the abdomen. He said, pack the place with water. With towels. He said, packed. Life story. He said, packed the wound, packed it, leave it till the following day. Go and sleep. And he went and told the colleagues. They just looked at him, because there were many of them. He just packed the thing with abdominal towels. He went and slept. He said, the following day, open it, it will be gone. And the following day, he went and opened, they were dry bleeders. That is experience. So we thank God for that. Mentorship. This is the crux of mentorship. I'll also tell you a life story of mentorship, mentoring in medical practice. This helps in upholding excellent ethics and empathy. Oh, thank you. What you do matters. What you do matters important. Recently, Maxwell published 13 messages of mentees to their mentors. Published. They are all published. You can access it, maxwell.com. And they were thrilling. But I want to capture the one that concerned me. One of them was a pediatric cardiologist. You know, our work sometimes will be very delicate. Pediatric cardiologists, so many. You have fetal, you have interventional. He described the mentor that she possessed what seemed like diagnostic wizardry. It was a lady, a man to a lady. He said she could predict a patient's past history and the exact contents of radiological reports before seeing them. Based solely on a clinical examination and history taking. I'm bringing this to encourage you not to jump. There's no shortcut in medicine. That is why clinical history, very important. You don't jump into what you have not heard and what you have not examined. And if the person is not examining well, there'll be a problem. You say, at first I thought she was cheating, but I soon realized she had mastered the lost art. That is what I'm trying to bring. The lost art of truly listening to patients. I brought you an example of Mother Teresa. She said, listen to patients. In fact, as a doctor, you can keep your Bible and listen. I love the psychiatrists. They can listen for hours and are not tired. He says, she taught me that investigations, which is all we know, should confirm diagnosis, not create them. A philosophy that has allowed me to identify conditions other clinicians miss because they jump to test instead of understanding the patient's actual time. She was humble despite her seniority and was able to assist the young man. And this is a profound case of excellent mentorship. What are your roles as doctors in nation building? You are supposed to be an advocate for public health. You have been taught enough. Contribution to community development and health education. Leadership during epidemics. You are supposed to be the leader. And national emergency. Promoting equity and accessible health care. These you have learned in family medicine. Your teachers are here, and community health. Advocates. I left the last one for each of us. Politics and governance. Get involved to get policies done. That is where you are supposed to be. What are your roles? The role of society. We have been talking about the roles of doctors, inductees in medical practice. What about the roles of society? The society owes medical medicine, they owe it a duty to maintain excellence. Your check and balances is what would drive practice. Drive practice in training and retraining. Training and retraining. These young men and women have just been inducted. They still need training and retraining. There was a story, another story, of a village head, not the one around us here, who had a subject that was a doctor, or was to be a doctor. And he had gone to interface that young man has spent a lot of time. Can they assist him? Eventually the young man finished. I was posted around his area. When the village head got sick, he was very sick, almost semi-conscious. Immediately he was told that they were taking him to that hospital that his subject was, he woke up. So I hope you are all waking up. He had forgotten that they were retraining and training going on, and that young man has imbibed a lot. You owe us this. You owe us to establish research center for medicine. We lack them in this part of the world. You owe us state-of-the-art medical facilities. As CMD is here, you are trying a lot to improve. When you go outside the shore, some of us that have been there, you see a lot of different. Medicine is now a state-of-the-art practice. I know in community health, we used to talk about appropriate technology. But technology has moved to AI. So let us imbibe it. Then, they owe us remunerations to doctors. In other climes, the public are the one that advocates for good pay for doctors. We have some examples of doctors, yes. Lessons from great physicians on remunerations. I know each time the guest lecture come, we mention this. We have them. We have Hippocrates. Hippocrates states that do not treat free. For those who receive treatment without cost, stop valuing their health. And those who treat without compensation, stop valuing their work. So value their work. We have another one, Galen. They are all physicians. Great surgeon, philosopher, medical writer, who were in the Roman Empire in that year stated that fair compensation frees the physician's hands for bold decision and the mind for deep reflection. He said that a society that underpays its doctors ultimately harm itself. We won't see them. That may be one of the reasons we have high flyers, the Japa syndrome. Then another great man, 980, another physician. He said physician work must be generously rewarded, for they are entrusted with human life and health, the greatest of all values. The greatest thing we ever need is life. Without it, doesn't mean anything. A doctor burdened with survival cannot fully devote themselves to healing. Of course, we had the last man who stated in his writing, the beginning the treatment. He stated that regular payment helps keep the doctor-patient relationship grounded. And in reality, maybe because you book an appointment, you didn't do well for your doctor, then there must be a problem. Making Sponsio Academica more excited. We need to keep to quick release of results after examinations, that is to our college, and also to reduce the long delay. I'm sure these young men have been waiting to call themselves doctors. And the rep was asking them not to put doctor when they were declaring. So let us try and do this oath taking as I stated earlier. And maybe adjust to the centralized control of swearing in from the council instead of over-dependent on the MDCA. So he's going to take that back to the registry. What are the charge? My charge to inductees will soon end. It's just a summary of what I've done. I say, let excellence guide your practice. Let ethics govern your decision. Let empathy and compassion define your service. Let respect, integrity, and honesty be your watchwords. These are ethical values you must not let go. Complete ethical values. Hold them dear. Let documentation of communication and communication of documentation with patients or patient encounter lights your practice. This will help you in case of litigation. There was a young man in my department who, when I was doing round, he would write every date, every time. And so unfortunately, a child that was abandoned by the father came to sue the hospital. The CMAC then just photocopy the documentation and send it to him. He was a lawyer. I think today he has not come. It's more than 20 years. The documentation was very clear. When the documentation are not clear, you are bound to have problem. Let capacity, we are talking about excellence, and capability determine your practice. Let medical knowledge be your life. Learn it, grab it. Of course, let mentorship inspires you. What are my inspirational charge? You just have 3 pages. Wear the title Doctor with humility and responsibility. Remember that every patient is a human being deserving of dignity and care. They did this rabbi Moses, the same thing, bent down. He stated that the physician himself should not treat the body without also caring for their own. You need to care for your own body as a doctor. I was going through the requirements for people to fly. Every pilot that is less than 40 years has every year must do medical checkup. If you are more than 40 years, not in practice, in age, every 6 months, you must show your medical. I think we can adopt it, sir. We need it. A prayer of strength and divine rewards is, but you be strong and do not let your hands be weak. As a doctor, your hand is weak, look for help. For your work shall be rewarded. 2 Chronicles. Therefore, value the nobility of the profession. What is my final charge? My final charge to everyone, especially to the inductees, I use the words of Apostle Paul in the epistle to the Philippians in chapter 4, verses 8 and 9, to remind you to hold on to the noble calling of medicine, maintaining excellence, ethics, and empathy. Finally, stated, finally, brothers, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent and praiseworthy, think about such things. I implore you to do so. Verse 9 said, whatever you have learned from us, from me, from all your teachers, whatever you have learned or received or heard from us or seen in us, put it into practice. And the God of peace will be with you. In my conclusion, the chairman, the reps, and the parents, the inductees, medical profession is a noble profession. Guard it and protect it jealously. I encourage you to uphold the excellence, maintain the ethics, empathy, compassion, and honor of the profession. I congratulate you once again. Arise, shine, and conquer. God bless you.
Thank you very much. Well done.